why may you be referred to pelvic physical therapy, or why should you go to pelvic physical therapy even if you already know that you're going to be having bladder surgery? So first, let me tell you about one of our patients, Mary. Mary is a 55-year-old woman who has been experiencing bladder leakage that's gotten worse over the past probably 2 to 3 years. And that bladder leakage happens on the way to the restroom, and where she gets this urgent feeling that she's got to go and then she can't get there in time. And she's also dealing with leakage when she coughs or sneezes or laughs. And like I said, this has gotten worse over time. So she has been scheduled for a bladder sling procedure to help with her bladder leakage, but her doctor also referred her to pelvic physical therapy before the surgery. And so Mary, like I said, was a bit confused as to why she was referred to pelvic physical therapy before her surgery. And this is actually one of the common reasons that we see people preoperatively, is that Mary has something that's called mixed incontinence. So she actually has kind of two different types of bladder leakage. She has urge incontinence, which is that leaking with that sense of urgency and can't get to the bathroom in time. And she has stress incontinence. That's the leaking with the coughing, laughing, and sneezing. And the bladder sling procedure can work really well for people to help with stress incontinence leakage. And so that procedure is most likely going to help Mary stop leaking with coughing, laughing, and sneezing. But it's not going to do much anything for her urge incontinence. And actually, we have had patients that their urge incontinence issues actually get worse after having some type of a surgical procedure for bladder leakage. So coming to pelvic physical therapy first to help get the urge incontinence under control can be very, very helpful. So there's lots of different techniques that we can do to help with that urgency and teach Mary techniques so that she can get to the bathroom in time, so that she's not having the urge incontinence. So not all types of bladder leakage are the same, and some, like urge incontinence or urge leakage, do not respond well to surgical interventions and maybe need some other type of intervention like pelvic physical therapy. So that is the first scenario I wanted to talk to you about, Mary, who had mixed incontinence. And then I want to talk to you today about one other type of scenario that we see commonly, and actually just saw a patient earlier this week named Sharon. And Sharon is a 63-year-old woman who has been experiencing bladder leakage for probably the past 4 or 5 years. It's gotten worse, where she has leakage when she's getting up and down from a chair, when she's bending over. She likes to garden and she bends over a lot to do that. When she's squatting, when she has to lift anything. And so she has noticed that she's had to wear progressively more and more pads throughout the day because of her leakage, and so wanted to do something about it. Her doctor recommended surgery to help with the leakage, but also referred her to pelvic physical therapy ahead of time. And again, like Mary, Sharon was concerned and confused why she had to do both therapy and the surgery. She thought that the surgery would fix everything. And we hear that a lot, like the surgery is just going to fix my leakage. And I like to equate this scenario to orthopedic situations. So a lot of times patients, common orthopedic surgery is a total knee replacement. And it is very common for patients who are going to have a total knee replacement to go to physical therapy preoperatively to make sure that the muscles are as strong as they can be and working as well as they could be, that they have as much flexibility as possible. And then they go to therapy again after the surgery to make sure that the muscles heal and work the way that they should be doing it. It is extremely uncommon that a person would go in for a total knee replacement without having preoperative and especially postoperative physical therapy. Yet we have surgery for abdominal issues and for bladder leakage issues all the time without any type of physical therapy. And in this case, in Sharon's case, she thankfully got referred for physical therapy. But if you find yourself in a scenario like Sharon, you may have to be the one advocating to go see a physical therapist first. But Sharon's doctor referred her to physical therapy before her surgery to help with her bladder leakage. And when we did the evaluation, what we discovered was that Sharon and thought she was contracting and using her pelvic floor muscles the right way. But in all honesty, she was actually pushing down and pushing out on the pelvic floor instead of contracting the muscles up and in. And so anytime she thought she was using the muscles well, she was actually putting a ton of stress and pressure and force down through her pelvic floor. And this probably was one of the reasons why it led up to her needing to have a surgery. And then if she ended up having the surgery and then after the fact continued to use her muscles this way, that surgical repair wasn't going to last very long. And most likely she was going to need another surgery down the road because her leakage would most likely come back. So she needed to change how she recruited and used these muscles so that she got the best possible surgical outcome. So we worked with her before her surgery to make sure that she could correctly engage the pelvic floor the right way, use the muscles the right way while she was lifting, while she was getting up and down from the chair, while she was bending over. And actually her leakage got a little bit better before she even had the surgery because she started using her muscles better. And then afterwards, she hasn't had her surgery yet, but we hope to see Sharon again afterwards just to make sure that once her surgeon has released her, that everything has healed up well, to make sure that she continues to use those muscles well and that we continue to strengthen them and work them together with all of her core muscles, so her abdominal, her back, her hip, her buttocks muscles, so that she has the best possible outcome and that surgery lasts as long as possible. Because that's one thing that I hear commonly here at Legacy is that women have had previous bladder leakage surgeries maybe 5 or 10 years ago, and they tell me it's worked well for a little while, but then their leakage started up again. And now they're back trying to do something about it again, but they want to avoid another surgery. And I ask those patients, did you have any pelvic physical therapy the first time when you had the surgery? And the answer is almost always no. And that kind of breaks my heart a little bit, because if they had done physical therapy after the surgery to make sure that their muscles were doing what they need to be doing and working the right way, they probably could have avoided the leakage coming back and them having to see me down the road. So I'm a big advocate of partnering up with a pelvic physical therapist preoperatively to make sure that everything is moving and working optimally. And as we saw in the case of Mary, there are certain situations that don't respond well to surgery, and so getting a partner together to help with that aspect of it. And then again, on the post-operative side, working with the physical therapist to make sure that your muscles come back and do what they're supposed to be doing. There was a surgery in that area. Sometimes our muscles need a little help to make sure everything is working the right way.